When the UK hosted the Olympic Games back in 2012, it began with a lavish opening ceremony, as you do, and it took the opportunity of that ceremony to pay tribute to everything that, in the mind of the organisers, made Britain great. One central focus was Britain's National Health Service. Healthcare for all, free at the point of use, since just after World War II. Well, the consensus right now is that the NHS is broken. A 142-page report into the state of the health service has just been published, carried out by Lord Darzi, former health minister who led the independent investigation. So, what does the report suggest has gone wrong? And what's the bit that it and the government dares not say? Let's discuss. The complaint from the left in British politics has always, but always been, for as long as I've been alive anyway and old enough to pay attention, that the NHS is, quote, underfunded. This is both demonstrably true, but in one sense actually not at all true. I know, a bit confusing, so let's clarify. What the Darzi report identified is that from 2010, the period when the government imposed an austerity policy following the financial crash, NHS spending grew at only 1% in real terms, resulting most importantly in a, quote, starvation of investment. While more money has been poured into the NHS over the decades, too little of it went into investment in health assets and infrastructure such as hospitals. The NHS routinely raided capital budgets to fund day-to-day expenditure, and the, quote, missing billions in that investment hit productivity, left the service with crumbling buildings and a backlog of demands for maintenance spending. 20% of the buildings owned by the NHS, for example, predate the service's formation more than 75 years ago. Too much outdated equipment, too little productivity-enhancing automation. The report observed that it had been known for decades that better health outcomes could be achieved by spending differently, not more. Successive government ministers had promised to move away from focusing purely on hospitals, shifting more care into communities, more support into prevention. Lord Darzi concluded that while those promises had been made, in practice the exact opposite is what happened. The NHS budget was not spent where it should have been. This resulted in things like a decline in community-based nurses, a 20% drop in the number of health visitors who would work with families after the birth of a child. It meant more patients were not treated before requiring expensive hospitalisation, and that had led to surging waiting lists for actual operations and hospital places, and hence thousands of people dying earlier than they needed to because they weren't getting treated quickly enough. According to the Royal College of Emergency Medicine, the backlogs killed more people, 14,000 per year, than all combat deaths from the British Armed Forces during the lifetime of the NHS. Long waits have become normal and expected. Cancer mortality rates are higher in England than in many other high-income countries. Cardiovascular disease rates also headed in the wrong direction. Now, part of this, of course, is also made worse by certain societal changes, albeit ones that are not exactly unique to the UK. So, an ageing population, which means, of course, a higher percentage of people needing help with the diseases most associated with ageing. What are referred to as lifestyle diseases, by which you can infer soaring rates of clinical obesity, which are also adding to the pressure with, for example, soaring rates of diabetes-related conditions. The deterioration of mental health services has come side by side with an increase in rates of depression in the country, from 5.8% in 2012 to 13% in 2022. Then there was a pandemic, of course, and the overstretched state of the NHS going into that crisis meant that as high rates of staff ended up going off sick with COVID themselves, while the system was under enormous strain coping with everyone else having COVID, it was a period from which morale and energy has still yet to recover, with staff increasingly disengaged. This has left us in a situation where 1 in 5 deaths in the UK are avoidable. That's how they describe it. Technically delayable, I suppose, is the accurate description, because, it's coming for us all in due course. And as always, there are plenty of people saying that the answer to the problem, yes, you guessed it, more money. So the Health Foundation said getting the health service back on its feet will require sustained investment. The King's Fund, which lobbies for higher spending as a point of principle, called for greater investment in primary and community services. But here's the problem. Previous Conservative governments generally ring-fenced and protected health spending and made sure it went up in a reasonable amount. Health spending has gone up from a point where the UK service used to be highly efficient, one of the lowest cost services for higher quality outcomes. It has now become higher spending, nowhere near as much as the broken US system, of course, but higher spending than many, for generally poorer outcomes. The productivity of the NHS, in other words, has plummeted. Now, that's not a money issue. That's a systems issue. To give Keir Starmer and his new government its due, something I know lots of viewers are not keen to do, but let's call it as it is, it has used this report to say that money should now only follow systems reform. The current Health Secretary repeated a phrase that has been used before, saying that Britain risks becoming a health service with a country attached to it. Making this statement is one thing, finding ways to deal with it in practice, something else entirely. One of the reasons is that, as with all of these huge bureaucratic systems over a period of time, the status quo suits the providers reasonably well, and hence they are very resistant to the sort of change needed to actually make a difference. Fraser Nelson, writing in The Telegraph, recounts the occasion when a former Health Secretary, Sajid Javid, visited a Liverpool hospital that carried out prostate surgery 5 times faster and more safely with a robot than could be done with a human surgeon. Javid asked why this successful and efficient innovation wasn't being more widely rolled out. Well, surgeons don't like it, he was told. It was an internal political battle of epic proportions just to get it used in the cases that he saw. Do we suppose, if patients were given the option to choose, some of them might well have gone for an earlier surgery that is fast and safe, rather than the later one with the people who don't seem to be that focused on their best interests? One of the challenges, of course, in addition to these sorts of instances, is that the service suffers from impossible promises. Free at the point of use is a principle akin to Holy Writ in the UK, and the fact that it means many thousands are dying because there is so much more demand for the service than there is capacity doesn't seem to bother them as much as that principle staying in place. Meanwhile, doctors complain about huge numbers of missed appointments, which have a massively disruptive effect on them and reduce the efficiency of the services in quite a significant way. Some have suggested in the past that there should be a small charge, say £5 for an appointment, or if that's too unpalatable, then a £5 deposit when you make the appointment, which is only retained if you fail to show up. The principle, of course, is that people will value something more if they've paid for it, even if it's just a token amount, whereas a free good A free appointment, especially where there's no sanction if they behave badly and don't turn up, that can be abused without the slightest friction whatsoever. This gets argued down on the theory that the administration of the system would probably cost more than it would bring in. But I wonder really if the main issue isn't that it would cross that line, no longer free at the point of use. Meanwhile, while America retains the prize for health service that is the most expensive while still leaving a lot of the poorest people in ruin for the cost of essential care, the UK is doing its best to catch up with them. More money, less good outcomes. Since 2019, NHS spending increased by over 19%. NHS staffing increased by 23%. But the number of patients starting treatment increased by just 3%. Across Europe and elsewhere, there are a variety of systems, most of which, or a lot of which, are less dysfunctional than the British one. As a percentage of GDP, Britain spends more on its health service than Spain, more than Japan, more than lots of systems that deliver better outcomes. But learning from those systems and how they get those outcomes, adopting some of the ideas. To date, the Tories have never been willing to do it because the other side so successfully tarred them with the brush of not caring about the NHS. Sometimes it takes the side that has nothing to prove, that has always been associated with a thing, to be able to take courageous steps to reform that thing, because they're the only ones who are trusted so to do. That's rather what Keir Starmer and Health Secretary Wes Streeting are promising here, without saying it quite in those words. The question is whether they are actually prepared to do what it would take to take on the sort of controversial, term-defining seriousness in the face of all the howls of protest from vested interest and their own supporters that would inevitably follow. The alternative would be to talk a good fight, do a few token things that might make a difference to one or two subsets of statistics that you can point to as a success, while kicking all the other cans down the road yet again. I seriously don't know which they will actually do, but the truth is they face similarly high challenges on a number of fronts at once. And to be fair, the Tories knew this. In fact, many have suggested this was the real reason why Rishi Sunak called the election early. All the news in the following months, with prisons about to run out of space, NHS crisis, education crisis, inability to deliver on climate promises, all of those were going to give relentlessly bad headlines between then and a November election. So why not get it over with before that happens? Now you have Conservatives labelling, for instance, the early release of prisoners as a mad Labour policy, kind of glossing over the fact that the overcrowding happened on their watch and they had plans to do the exact same thing, because there kind of wasn't any choice. A topic for another video. So yes, Labour may turn out to be good in government, they may turn out to be terrible, but it's certainly the case that the problems they're facing can only be solved by biting some pretty unpopular bullets, being more courageous than the norm. From the Olympic ceremony of 2012, where the NHS was held up as being practically one of the wonders of the world, it is now much better known for its dysfunctionality. And that is not going to change overnight.